Good afternoon, and welcome to Clean Air for All, 50 Years of the Clean Air Act. I am Paul Billings, National Senior Vice President of Public Policy at the American Lung Association. Today's symposium is being recorded, and please use the chat function to ask questions, and if you're having any technical difficulties. 50 years ago, the nation was split on the war in Vietnam, civil rights, women's rights, and more. During the 91st Congress, the United States Senate even rejected 2 Supreme Court nominees. Yet against this backdrop of a sharply divided nation, Congress, Republicans and Democrats came together to pass the most powerful, far-reaching, and important public health law in the history of the world, the Clean Air Act. The law passed the Senate 73-0 and passed the House 375-1. The conference committee reports passed the Senate and House unanimously. The legislation was hard fought. There were significant disagreements. Compromises were made, but sometimes the Senate simply said no to the House or the White House efforts to weaken the bill. Also understand that in 1970, Senator Ed Muskie, the lead author of the bill, was considered to be a leading potential Democratic challenger to the president. And despite the overwhelming congressional support, there were voices in the administration urging President Nixon to veto the bill. As we know, Nixon signed the law on New Year's Eve. Today, we will reflect on this landmark public health law and look forward to the next 50 years and beyond. This symposium is the result of more than 1 year of planning. We have many people to thank. I will start by recognizing our supporters and partners, including the Hanley Foundation, PepCo, an Exelon company, ComEd, an Exelon company, the American Public Health Association, Clean Air Partners, the Environmental Law Institute, the Bay Area Air Quality Management District, the UN Environment Program, and the University Network for Human Rights. I also want to thank our co-hosts at the American University Center for Environmental Policy and the Center for Environmental Filmmaking. I hope that everyone has had a chance to view the award-winning film Unbreathable, The Fight for Healthy Air. It is a timely and powerful look at 50 years of the Clean Air Act and the challenges we still face to ensure healthy air for everyone. Check it out at unbreathable.org. We originally planned this event to be a day-long in-person event, and today's agenda includes 4 of the original panels. First, the promise of clean air, followed by innovation for cleaner air, then clean air and climate change in the 21st century, and we will conclude with lessons from the past 50 years under the Clean Air Act. Following the premiere of Unbreathable, we hosted a roundtable to discuss the film. We also hosted another roundtable with the next generation of climate and clean air activists. You can catch up on both events at unbreathable.org/webinars. We will also have a special keynote webinar on October 14th with Mary Nichols, the chair of the California Resources Board, and we'd love for you to join us. I don't have time to recognize all the individuals who worked so hard to make today's event a success, but permit me to mention 3. First, my former colleague, Lindsay Mosley-Alexander, who had the vision for this event, and the American Lung Association's Diana Van Vliet and American University's Danielle Miller-Wagner, who made this vision a reality. Now let's get started. I will introduce our next 2 speakers. Before I do, I urge you to extend this conversation on social media using the hashtags Clean Air for All and the Clean Air Act. Now to our first speakers. Harold Wimmer is the president and CEO of the American Lung Association. Harold joined the Lung Association in 1978 and has served in his current role since 2013. Vickie Wilkins is the Dean of the School of Public Affairs and Professor of Public Administration and Policy at American University. She's been an American for more than 6 years, having previously served as Professor and Director of the MPA program at the University of Georgia. First up is Harold, who will be followed by Vickie. Harold?
Thank you, Paul, for the introduction. I'm honored to welcome all of you to our Clean Air for All Symposium. We have more than 900 plus participants today from all across the country, united by our conviction that we can and must do more to ensure healthy air for all to breathe. At the American Lung Association, we often say, when you can't breathe, nothing else matters. I know that far too many of us here today don't need to be reminded of that feeling. To all of you who have been living with the impacts of COVID-19, dangerous wildfire smoke, flooding from hurricanes and tropical storms, or the daily challenges of living with a lung disease or near highways, power plants, or other sources of pollution, we stand with you. And let me pause to offer the American Lung Association as a resource. You can visit lung.org for up-to-date information on these threats and how to protect yourself from them. We are here to help you. Climate change is a health emergency. We know that climate change is worsening wildfire conditions and making extreme storms more likely, with dangerous implications for our lungs and health. We also know that too many communities are still living and breathing in the backyard of a coal-fired power plant or a major highway. But here's the good news. The nation already has a proven, powerful tool to clean up dangerous air pollution and make families healthier. Of course, that tool is the Clean Air Act, one of the single most important pieces of legislation to be ever passed to protect public health. Thanks to the Clean Air Act, many of America's most polluted cities are much cleaner. Over the past 50 years, the Clean Air Act has driven a truly dramatic change in communities across the country. This is a public health law, and it's saving hundreds of thousands of lives every year. But of course, the work is far from done. Nearly half of all Americans are still breathing unhealthy air, and this burden of air pollution isn't evenly shared. People of color are 1.5 times more likely to live in a county that has a failing grade for air quality. Approximately 150 million Americans are still waiting for the healthy air promised by the Clean Air Act. There is much more work to do. America needs the Clean Air Act to remain strong, fully implemented, and fully enforced for the next 50 years. The law puts health science at the center to make sure that major air pollutants get cleaned up and our air is safe to breathe. And it's the biggest and best tool we have to dramatically reduce the emissions that cause climate change. At the American Lung Association, we champion clean air for all. We're working toward a world where every child has clean, healthy air to breathe, where they learn, live, and play, where access to a safe environment is equitable, and where we can ensure a safe climate and a livable future. And I know all of you too. Thank you again for joining us for today's event, and thank you to the many incredible panelists we have that are going to share their time and speak with us today. I look forward to continuing our work together to fulfill the promise of the Clean Air Act, healthy air for all to breathe. Thank you. Now I'd like to pass it to my colleague, Dean Wilkins.
Hi, thank you. Thanks for that introduction and those remarks. Good afternoon, everyone. I am sorry that we are not together for this event. I know that we had a fantastic opportunity for us to gather and have these discussions. And I just want to send my thoughts and well wishes to all of you at this difficult time. And my wish for you is good health. And I want to make sure that you know that we are holding events throughout the crisis and beyond. And if you want to ever join an SPA, please check out our webpage to see what we have going on. The School of Public Affairs is thrilled to present this symposium in cooperation with the American Lung Association. They are fabulous partners and contribute so much to the health and well-being of our country. This year is especially exciting because it's not one, but 2 anniversaries of the Clean Air Act. The 50th anniversary for the bill in 1970 and the 30th anniversary for the Clean Air Act amendments of 1990. Now, Paul kind of stole the thunder of this political scientist when he already gave away the line that both these bills passed with near unanimous support. We know that doesn't happen very often in our politics anymore, but I think he was right to point out this happened through compromise and hard work. It didn't happen because it was easy and because everybody came to the table agreeing, but it became because people were willing to put aside some smaller things to get this greater thing done for all of us. The Clean Air Act remains such an important public health act, and it's an important part of how we grow to understand the major threats of pollution to our health and well-being. The more we learn about air pollution, the more we realize that the work that remains, not only in achieving cleaner air, but in reducing emissions that cause climate change. So I want to add my thanks to all of our speakers, the American Lung Association, the Center for Environmental Policy, the Center for Environmental Filmmaking, and for all of you have done to make this program possible. I also thank you, our participants. My hope is that we got a few more of you being able to be involved since we are virtual today, but I welcome you and thank you. Let's hope for another 50 years of cleaner air. Thanks.
Thank you so much, Vicki. And thanks everyone for joining us today. Now we'll get right to panel one, the promise of the Clean Air Act. And as our other speakers are coming on to video, I'm going to make a few introductory remarks. Again, I'm Paul Billings, National Senior Vice President of Public Policy at the American Lung Association. And I am an unabashed supporter of the Clean Air Act and a defender of Ed Muskie's legacy. It is my family business. My dad, Leon Billings, worked side by side with Tom Jorling, who we'll hear from later today, to craft the vision of Senators Muskie, Howard Baker, Tom Eagleton, and others into this law that has saved millions of lives. The Clean Air Act broke new ground for federal law in many ways. Paraphrasing Leon Billings, the law introduced novel concepts, mandatory requirements, statutory standards, statutory deadlines, establishment of scientifically based public health standards, and even the removal of economic and technical feasibility tests. It also eliminated weasel words, replacing may with shall, and introduced the key provision, citizen suits, the rights of citizens to force the government agencies to do the job the law requires. Today, we will explore many of these concepts and the power of the law. This symposium is a celebration of this success, but also a recognition that far too many people, 150 million Americans, are still waiting for clean air. Today's speakers will also discuss how the law's authors had the foresight to craft a statute that can respond to new scientific information and how to use the law's critical tools for sweeping solutions that are needed immediately to combat the existential threat that is climate change. Before I introduce our first panel, a bit of housekeeping. The event is being recorded and the recording will be publicly available after the event. Feel free to use the chat function and we'll try to get to as many questions as we can. And again, I urge you to extend this conversation on social media using Clean Air for All and Clean Air Act as the hashtags. To kick off today, we have a fabulous panel. There are links to their full bios in the symposium web pages. I will briefly introduce each speaker and I'll provide gentle prompts when their time is up. Our panel includes Dr. Mary Rice, a physician at Beth Israel Deconess Medical Center, an assistant professor of medicine at Harvard Medical School, and chair of the Environmental Health Policy Committee at the American Thoracic Society. Wayne Nastri is the executive officer of the South Coast Air Quality Management District. Peggy Shepard is co-founder and executive director at We Act for Environmental Justice. And Vickie Patton is the general counsel of the Environmental Defense Fund. First up, Dr. Mary Rice.
Thank you very much for the introduction, Paul, and thank you so much for inviting me to participate in this very important symposium celebrating the Clean Air Act. I'm a physician and pulmonologist, and it is clear that air pollution is unhealthy. I see these health effects among my patients with lung disease all the time. I see it in the form of uncontrolled coughing and wheezing in my patients with severe COPD who move to a more polluted home, like, for example, an apartment along a busy road in the Boston area. I see it in my younger patients who suffer more asthma attacks and need more asthma medications on hot summer days when the ozone levels in Boston can get quite high. These health effects worry me greatly because air quality is not good enough to protect my patients. But at the same time, I also celebrate the fact that air quality is much better than it used to be thanks to the Clean Air Act. Actions that have resulted from the Clean Air Act have lowered emissions from the major pollutants by trucks, power plants, and other sources by more than 70% since 1970. And as a result, people are healthier. Our lungs are healthier. Kids have faster lung growth today than kids who grow up in more polluted areas. And they also have a lower risk of developing asthma than kids who are exposed to lower levels of pollution. our life expectancy is longer than it used to be, and everyone has benefited from that. In fact, it's been estimated that our life expectancy is about a year longer today than it was in 1980 as a result of the improved particulate matter levels. In fact, the Clean Air Act is widely cited as one of the most cost-effective policies in US history because the benefits to human health and productivity have been so great, exceeding implementation costs by a ratio of 30-to-1. And one of the beauties of the Clean Air Act is that air quality standards for major pollutants like particulate matter and ozone are revisited every 5 years. And through research, we continue to learn more about how these pollutants affect health, not just the lungs and the cardiovascular system, but also the brain, the reproductive system, the endocrine system. And as air quality has improved, it has become evident that there are health effects, including serious health effects like premature death, particulate matter and ozone levels that are within our current air quality standards. And historically, one of the strengths of the Clean Air Act has been a robust and very rigorous scientific review process with input from a diverse group of experts, including, for example, exposure scientists, public health epidemiologists, toxicologists, who've helped make sure that EPA is doing a good job of reviewing all the latest evidence. In the past few years, though, there have been huge cutbacks to science advising at EPA, and other changes, like EPA's pending transparency rule, threaten this rigorous process. For example, during the last particulate matter and ozone reviews, the standards were left intact. They were left unchanged, despite very clear evidence of serious health effects at exposure levels that we experience today within the current standards. So, the Clean Air Act is not perfect, and it does not provide enough protection to people who live in hotspots with high pollution levels. It also doesn't nearly go far enough in protecting public health from the air quality problems of climate change. So today we must celebrate the dramatic improvements in air quality and public health that we have gained from this act, and we must learn from our past success so that we can achieve more in the future. Thank you.
Thank you, Mary. Next up is Wayne Nastri from the South Coast Air Quality Management District. Wayne?
Thanks, Paul. It's a pleasure to be here, and I want to thank the American Lung Association and American University for hosting this tremendous event. There's no doubt that the Clean Air Act has yielded many positive benefits. It's provided a good framework for addressing air pollution. It did so by establishing that you have science-based standards that reflect and are protective of public health. It provided for a federal-state partnership to allow states to work cooperatively with EPA to develop long-term plans to attain standards as expeditiously as possible. And it also provided states with the ability to set more stringent requirements to address more localized concerns. We'll hear a little bit more about this a little bit later. And it also forced the development of cleaner technologies, such as cleaner engines and emission controls. I think we all know about the catalytic converter as one of the top success stories of the Clean Air Act. And today, new vehicles are 99% cleaner than they were in 1970. But these resulting emission reductions have been dramatic, and our economy continues to grow. Our GDP and VMT have more than tripled. Population has increased by more than 60% since 1970. And meanwhile, criteria pollutants are down an average of 73%. So some emissions like lead have been virtually eliminated, and health benefits have really far exceeded the costs that we heard Dr. Rice talk about. EPA's 2011 study found that benefits of the Clean Air Act exceeded costs 30-to-1 through 20-to-20. And that same study showed that in 2020, Clean Air Act actions would result in over 230,000 fewer deaths, 200,000 fewer heart attacks, 120,000 fewer ER visits, and a savings of over 17 million lost workdays. But at 50 years, we're now seeing some areas that need improvement. And there's two areas that I want to touch on. First, the Clean Air Act is structured to give state and local governments the responsibility for clean air, but not always the authority to regulate sources of pollution. And despite the success in reducing emissions, over 50% of our country is living in areas that do not attain the national ambient air quality standards. Years of tightening regulations on stationary sources, such as power plants and factories, means that mobile sources such as trucks, trains, planes, ships are now more responsible for air quality concerns. But these sources are controlled at the federal level. State and local government find their hands increasingly tied as they're being held accountable to meet air quality standards, but lack the authority to regulate the cause of pollution. For example, it's no secret that Southern California is home to the highest ozone concentrations in the country. Yet over 80% of the pollutants that cause ozone are from mobile sources, the bulk of which are from trucks. And while CARB has taken steps to tighten emission standards on trucks, most of the trucks in our area are from out of state. EPA hasn't revised the emission standards for trucks in over 19 years. We're facing a hard deadline to meet the federal ozone standard in 2023, but even if we shut down all the sources that are under our authority, we still wouldn't reduce emissions enough to meet the standard. So nowhere in the Clean Air Act is there an obligation imposed on EPA to take action when the sources that are causing unhealthy levels of air pollution are solely subject to federal regulatory authority. So in fact, the Clean Air Act envisions punishing state and local governments for failing to attain standards, regardless of whether it was within their power to control the sources of pollution thereby. So second, the Clean Air Act has delivered success on reducing criteria pollutants on a regional basis, but it hasn't proved a good model for addressing the local impacts of air toxics, which disproportionately occurs in disadvantaged communities. And these greatly impact the health of communities who live close to industrial sources and those which are disproportionately occurred in disadvantaged communities, such as freight facilities, freight corridors. There's nothing in the Clean Air Act that provides for evaluating localized health risks and then requiring facilities to contribute those risks to reduce their emissions. So in Southern California, we're taking steps to address more localized forms of air pollution and health risk. A relatively new law, AB 617, requires air districts to identify disadvantaged communities, looking at a variety of different factors, and then work with the community to identify what are those areas of concern within the community, what are the pollution impacts in environmental justice communities. And we do monitoring. We work together to identify what are various measures. We invest heavily in incentive programs so that we can accelerate the retirement of older, dirtier trucks, for instance, that are in those areas, replace them with cleaner technologies in those impacted communities. We also have a comprehensive suite of air toxic rules that are aimed at specific industrial sectors, such as metal platers, metal finishers, to install the best available emission controls that are far above and beyond what would be required by the federal government. So we also have programs requiring facilities to submit detailed inventory information on air toxics. And if they're above a certain level, they need to evaluate those risks associated with their emissions, notify the public, and develop plans to reduce those risks. And finally, we have what's called our multiple air toxics exposure study. We conduct every 4 to 5 years to evaluate the level of air toxics in our area and model the cancer risks associated with these emissions. And while state and local government have the ability to set more stringent standards, not all states have the ability or resources to do so. So this is a start, but more definitely needs to be done. And I hope that we can continue to build upon the success of the Clean Air Act and make the next 50 even better for all of us, where we all truly have access to clean air and better public health. Thank you.
Thanks, Wayne. Next up is Peggy Shepard, the founder and executive director of We Act for Environmental Justice. Peggy?
Well, good afternoon, and thank you to the American Lung Association and all of the sponsors for this important program. You know, lately, I've heard some advocates say that we need an environmental bill of rights, that we all have the right to clean air, clean water, and a toxic-free environment. I've also heard a prominent environmental justice attorney consider whether environmental justice groups should pursue equal enforcement of environmental laws, since they are inherently not protective of frontline and Indigenous communities. So as we celebrate the 50 years of this clean air regulatory legacy, the environmental justice movement celebrates nearly 30 years of building its capacity, its stories, its presence into a global movement, one that challenges the disproportionate burden of pollution and environmental degradation borne by low-income Indigenous and communities of color. Now, our vision of environmental justice places human health at the center of environmental struggles because we know that our physical environment and the zip code in which we live is an important determinant of African Americans' health, the population with the most glaring health disparities in the nation. We've also known for a long time that breathing dirty air increases the risk of premature death from heart attacks, asthma, and cancer. 71% of African Americans live in areas that fail to meet air quality standards set by the EPA, and over 80% of Latinos live in non-attainment areas. Now we know that there's new research using data from a prior Harvard study that has found a clear link between COVID-19 mortality and the chronic PM2.5 exposure that disproportionately impacts communities of color and low income. And in a preliminary study from Harvard in April, researchers found that even small increases in fine particulate matter, known as PM2.5, corresponds to about an 8% increase in COVID-19 deaths. So African Americans and others who face long-term exposure to pollution of 15 to 20 years in over 3,000 United States counties, they had much higher death rates from COVID-19, which has really exposed this racial disparity. Now, my research partners at the Columbia Children's Center for Environmental Health at the Mailman School have shown that prenatal exposures to PAH are associated with significantly reduced fetal growth, an increased risk of developmental and behavioral problems, reductions in IQ, asthma precursor symptoms, and changes in gene expression. Yet by most reports, the Clean Air Act has substantially improved air quality nationally. Yet it is evident that the localized effects of air pollution were not well considered or written into either the original Clean Air Act or its amendments. For example, who thought it was a good idea to carve sewage treatment plants out of the Clean Air Act regulatory scheme? Clearly, it was not the citizens who live near these facilities, like the ones in West Harlem, who joined with We Act to sue the New York City Department of Environmental Protection under a nuisance provision, not the Clean Air Act, in order to stop the noxious odors and emissions that were emanating from this plant, which is located across the street from their homes, their park, and their playground. So we really need to collaborate on a new set of priorities with an integrated policy approach so we can identify and capitalize on win-win opportunities for climate and health. We must pay special attention to children, pregnant women, and populations that are more vulnerable to the health impacts of both climate change and air pollution. And those most affected by localized sources of air pollution and their advocates should be included in every step of the regulatory process and on relevant EPA federal advisory committees. Because without this level of integration of the representatives of affected communities, the end product of future Clean Air Act regulation and enforcement will continue to be less than comprehensive and protective. So going forward, I believe we need accurate information on air pollution levels, so let's restore the cuts to air monitoring programs and ensure that localities have robust air monitoring networks. Let's stop exempting livestock operations from reporting emissions that originate from animal waste. And we need aggressive enforcement of air toxics emission standards in communities most affected, And we need to revise risk-based air toxic standards that have not proven to be protective of the most vulnerable. We also should begin to identify climate strategies and technologies that will result in the most air quality improvements and update analytical tools to ensure that they accurately account for health risks and benefits. And because of the close linkages between CO2 and other combustion-related air pollutants, policies aimed at mitigating global climate change will also benefit local and regional air quality. And finally, as the environmental justice community has experienced and understands too well, the EPA's delegation of authority to the states has not served all communities well. The Clean Air Act requires that each state adopt its own plan to control emissions, but many advocates think it is time to replace the state plan requirement with federal regulation. The state implementation plans have reached the tipping point of irrelevance on health outcomes. It is time for reform. Let's build on our progress and incentivize innovation. We all have a human right to clean air. Thank you.
Thank you, Peggy. And then finally on this panel, before we get to the questions, is Vickie Patton from the Environmental Defense Fund. Vickie? And please turn on your camera and unmute, Vickie. There we go.
Headlines in the New York Times on September 23rd, 1970 read, "Tough Clean Air Bill passes Senate 73-0. The legislation that was ultimately adopted at the end of December, only a few weeks after the creation of EPA, has achieved profound progress in addressing a number of air pollution challenges. We also face critical and urgent and equally profound unfinished business in addressing the disproportionate and lethal impacts of air pollution afflicted in communities all across the country. Researchers at Resources for the Future examined satellite data that showed 24 million Americans, double the number identified under the Clean Air Act, are breathing lethal particulate that exceeds our nation's health-based standards, but are not being revealed and protected under our nation's clean air laws. An analysis that Environmental Defense Fund undertook in Oakland in partnership with Google, thousands and thousands of measurements identified exposures in communities and neighborhoods that were 8 times that revealed by the background air pollution monitors in the community, meaning that 40% of the elderly in Oakland suffer from very high risk of heart attacks. In Houston, 30 million measurements gathered all across the community showed that Houston's 5th Ward experiences air pollution levels that are more than half greater than all other parts of the community. And schools all across Houston suffer from higher air pollution levels. We have important unfinished business to do to realize the right to clean air for all. While the US government has been afflicting harm by taking the country in the wrong direction, states are leading the way all across the country. As Wayne Nastri indicated, in California, Assembly Bill 617 provides a model for addressing community-based air pollution problems from the community, bringing in community perspectives, drawing on localized data. In New Jersey, a historic environmental justice legislation is moving forward with the leadership of Senator Troy Singleton. As Peggy Shepard indicated, the imperative of that legislation in New Jersey is to realize the right that all Americans have, regardless of zip code or race, to clean air for all, to clean water to drink, and to a life free of toxicity. In Colorado, House Bill 1261, sponsored by Casey Becker, Speaker of the House, Angela Williams and Dominique Jackson, two prominent African-American leaders in the Colorado General Assembly, and Faith Winter addressed both the urgent challenge of science-based climate action and the imperative to protect communities disproportionately impacted by climate pollution. This is the path forward as our nation, 50 years after that historic New York Times headline, is grappling with the urgent imperative to achieve greater justice for all and the profound climate crises that are afflicting communities and states all across our country. We must address the challenge of both climate and air pollution to finally realize the promise of the nation's Clean Air Act. Back to you, Paul.
Thank you, Vickie. And the first question's coming to you, Vickie, but I hope that at least Peggy and Wayne and maybe Mary will weigh in too. An important attribute of the Clean Air Act is the ability for citizens to hold policymakers accountable through public participation and citizen suits. How have these tools been used traditionally, and what new applications or tools should be considered in the future to further democratize clean air?
The citizen suit provision of the Clean Air Act was the first of its kind to give citizens the power to hold the government and polluters accountable. It forges into law the right for citizens to take legal action to compel EPA officials to carry out the law as the way it was written and intended to protect public health and the environment. And it also provides for lawsuits against polluters who are violating Clean Air Act pollution standards. At the time it was adopted, Senator Muskie, Howard Baker, Leon Billings realized they were taking a path-breaking step forward and creating kind of greater democratization of environmental law and environmental protections. And indeed, that feature of the Clean Air Act has been adopted in over 15 other environmental statutes, including the Safe Drinking Water Act, the Clean Water Act, the Resource Conservation Recovery Act, Superfund, Endangered Species Act, and many others. We, however, have a world where the data does not provide the information that reflects the harm that is happening in communities and neighborhoods. And so for the Clean Air Act to have legitimacy and for it to realize Peggy's call that we achieve clean air for all, we must do a far better job in collecting and disseminating community-based information about the air pollution harms. And this is going to require a reform of the way that the Clean Air Act gathers and shares data. It's all within the contours of the Clean Air Act, but we need to integrate better information, better pollution data that reflects the real harms afflicting millions of Americans into all aspects of the Clean Air Act. And that will ensure that this democratization of enforceability, as reflected in the citizen suit provisions, addresses the serious harms that are happening in people's communities and neighborhoods.
Well, maybe I can add a little bit to that just to give somewhat of a different flavor. I mean, I agree with everything that Vickie said, and I agree with the intent of why those provisions were added. But you know, in today's reality, at least for California, this is a real life example. About 3 weeks ago, I was literally on the phone with US EPA, the governor's office, and a power plant facility, or the subject was a power plant facility, where because of the heat wave, because of the stress to the grid, we had a tremendous need to make sure that power was being provided to the grid. Yet this facility was concerned that they would not have the executive order exemption, if you will, from Title V, from the federal provisions. So even though the governor had issued an executive order under a declaration of emergency, this facility didn't want to increase power generation to the grid. And so because of the fear of federal suits. And despite the fact that there were, I want to say 2, if not 3 former regional administrators saying US EPA will not take action in this particular case, when you have so many people that are relying on a stable power supply that would be impacted from an adverse health impact. So that was one example of where I think people were very concerned and took it to an extreme. But I think that also we do have facilities that are right in the middle of disadvantaged communities, and they need to be doing everything they can, and we shouldn't be asking those facilities to operate and put additional burden in those disadvantaged communities. So the challenge though that we have is that you also have people that have medical conditions that are reliant on power. And I can tell you this past weekend, we received a number of people saying, you're holding us from getting power because you're requiring them to use tier 4 engines instead of, tier 2 or whatever's available. And so there's all of these provisions which sort of sometimes come into conflict when they're really not addressing the issue that it was intended to, which I believe is more of a chronic long-term impact in disadvantaged communities. But the real world application sometimes is a little bit more difficult.
Just want to say that we have to be really careful about false choices. For half a century, our country has successfully provided reliable electricity while ensuring that we have a pillar of the Clean Air Act in place, and that is this crucial accountability that is provided for citizen suits to enable all Americans, when they are seeing violations of our nation's air pollution standards, when they are seeing the administrator of EPA fail to carry out her or his solemn responsibilities under the law to protect human health, to take action, to be part of the solution. And we can readily avoid these false choices and that are often presented as impediments to real important progress, where we ensure that citizens have a stake in carrying out the promise of the Clean Air Act and doing that in a way that ensures reliable electricity. And the areas we need to focus on that are urgent are those that Peggy highlighted, and that is that there are communities where millions and millions of people are breathing unhealthy air. How do we ensure that that data is gathered and that data becomes part of the fabric of our nation's clean air laws, so that as we are carrying out the citizen supervisions, we're taking steps forward and creating greater justice.
I'd also like to talk about the tool of public participation. We really need to define what that is. Is public participation simply going to a hearing and having 2 minutes to make a statement with no response? Is that public engagement? Or for instance, if I go back to 1997, where I worked with EPA Region 2, to have them come out and work with community members to figure out where should we place air monitors, where we can really focus on fine particulates. And so they worked with community residents to walk around the community and understand where the most trafficked intersections were, where these monitors need to be placed. And then the EPA was able to fund these monitors, which were the first community-based air monitors ever in New York City. They then funded the state to make those monitors part of the state air monitoring network. So again, when we talk about public engagement and public participation, we really need to define what that is. Is it helping to really provide experience and expertise on where the problems are? Is it being involved in a federal advisory committee that helps determine implementation of the plan? Is it the EPA going out to localities and having roundtables to understand the lived experiences of regular residents? So we really need to begin to define public engagement, public participation, because what we have now does not engage anyone.
Peggy, I think at the local level, you'll be, I think, heartened to know that we're doing almost, I guess, what you did in 1997, going out into the communities, having the communities tell us on maps, what are the industrial sources there? What are some of the experiences that people live in the area in terms of their health impacts? Looking at emergency room visits and looking at the sources, working with the cities, working with the local chambers, and identifying what is the suite of monitoring that's going to go there, whether we're looking at diesel particulate, whether we're looking at metals, whether we're looking at VOCs, all of those go into play. And I will say this, it's a very intense process. And I think the people that are working on the ground implementing that need to have training, right? Because it is a very different experience. And oftentimes you're going into communities where there's a tremendous amount of frustration, and rightfully so. But the challenge is that the people that are going out want to help. They want to do the right thing. And yet we're not, let me restate that. Oftentimes the community doesn't trust government when it does come in. And that's where I think there has to be increased dialogue, because as I just said yesterday, nobody in this room caused this problem, but everybody in this room is working to solve it. And the importance of public participation cannot be overstated, but it is not simple, it is not quick, it takes time. And in fact, one of the challenges that we have under AB 617 is that not only is there a desire for increased public participation, but there's a demand for results, for results that are within months of once you identify a community. And I understand the legislator's desire. She wants to see results in the community, but to build that trust, to build those relationships in the community, to build those plans, it takes time. And I think that's an inherent tension between the people on the ground from a government perspective that want to implement and meet the requirements of the law and know that you have to do it within a certain time frame. And you may not have the input from the community to the point where there's consensus. And I think that's another important part, is that there's got to be consensus within the community, because oftentimes we'll have different community groups with different views and different aspects. And when you're dealing with a community of several 100,000, one group can be much more vocal than another, and how do you work those issues? So it's tremendously important, but it's tremendously complex and difficult and takes time.
Well, there's more time on the front end, but then you don't have the hospitalizations and the cost on the other end. And I'd also say we're in a very racialized society. So think about small communities in the South, where states are the primary, they're the primary environmental regulator. There's virtually almost no public engagement going on in some of those states. And some of the states where most of their tax base is coming from a chemical or oil refinery that's causing the problems, you will find that those states aren't even collecting the kind of data that an advocate would need to advance, the issue. So again, all states are not created equal. And in this racialized society, we find that there's not true public engagement across this country.
Peggy touched on the importance of data. The incorporation of new science into policymaking has facilitated progress toward protection of public health. However, the current EPA's practices put the Clean Air Act and ultimately the health of Americans at risk. How can and should we respond to new science that shows we need stronger air pollution protections to adequately protect public health, especially in this absence of federal leadership?
I can comment on that. The Clean Air Act compels the EPA to protect human health with an adequate margin of safety. And in some ways, the Clean Air Act can be used as a tool to compel EPA to act. And just to give some examples, like I mentioned in my opening statement, the science over the last several decades has been clear that people are dying prematurely from PM 2.5 exposure and ozone exposure, even at levels that are within the current standard. And the discussion that we just had, I wanted to add to it as someone who studies the health effects of air pollution to point out that the issue here is that the way EPA monitors air quality is using and regulates air quality is using these regional monitors that are generally placed in areas that are supposed to measure background air pollution. So when I'm talking about there's health effects within standards, that's just looking at the background air pollution, right? It's not even getting at the local level that Peggy's pointing out. You know, that effort in 1997 in New York City addressed, and what Wayne's talking about in California, that there are pollution levels that are much higher. We know there are. So the health effects that we're estimating from the science and published reports using the state monitors in a way is underestimating the health problems, the health effects of air pollution. And yet that's what we're regulating on. So I think, you know, at this time when EPA leadership in some ways seems more motivated to protect business interests in the fossil fuel industry than human health with an adequate margin of safety, and is really whittled down on science advising to make sure that that latest science gets looked at and considered rigorously, we need to turn to the legal system. We need to turn to public comments, and we need to compel EPA to act in the public's interest to protect human health.
I would just add that the time-tested history of the Clean Air Act until now has been adaptive to incorporate the best available science. And that feature has saved tens and tens and tens of thousands of lives. It has addressed far-reaching human suffering. And just a few examples, the action decades ago to address the lead in gasoline when a pediatrician in Pittsburgh began identifying that children had high lead levels in their bloods due to the lead in gasoline. The groundbreaking work to address particulates from motor vehicles, the establishment of sulfur dioxide limits on coal plants throughout the 70s that was contested, the landmark health-based standards for respirable particulates that are breathed deep into the lungs and that kill thousands and thousands of Americans that were established in 1997, and the crucial work today to address localized air pollution harms, the methane and other contaminants from oil and gas, and carbon dioxide that is causing profound health and climate harm. You know, it's really been a tremendous credit to the architects of the Clean Air Act that it was designed to incorporate the best available science. And I can't underscore just how serious the threats are from the current administration as they advance the censored science effort to really disable and to do deep damage to that defining feature of the Clean Air Act, that it really has protected human health in really important ways. We have obtained some records that show that effort, that censored science initiative of this administration is manifestly an attempt to do an end run around Congress, that because Lamar Smith, former chair of the House Science Committee, could not successfully secure legislation, he went to the EPA leadership in the Trump administration and asked them to pursue it. We also have a briefing that shows that they are targeting particular scientific studies that are really urgent in protecting the lives of Americans. And so this is a really defining moment in the history of the Clean Air Act and its long legacy of responding to the science that has provided healthier, longer lives for millions.
Vickie, can you give us like the 45-second of what the censored science proposal would do? And then maybe Dr. Rice can mention what that actually means.
The EPA has long relied on peer-reviewed, replicable data and studies in supporting its policy actions. And so this is an effort to try to distort the debate and confuse the public in a really cynical way by saying, because individualized data that underpins some of those studies is not disclosed publicly, even though it is replicable, it is peer-reviewed science, and the only reason the individual's data is not available is due to health imperatives in terms of privacy. That those studies need to be excluded from our nation's crucial public health protections. This is really a cynical way at getting at studies like the particulate matter studies that have long demonstrated the death and disease associated with particulate matter exposures, and that some in the regulated community have been trying to attack for decades, including unsuccessfully in the US Supreme Court. And so this administration has taken up that cause in a really threatening and cynical way to just in a sweeping way exclude studies that demonstrate really serious and urgent harm.
Yeah, the rule's called transparency and regulatory science. So it sounds at face value like a good thing. Transparency is something we all want. But the detail of the rule, the crux of it, is that in order for the EPA to consider any study in making a rule, we're not just talking about air quality, all environmental regulation, so it cuts across everything. The underlying data of that study must be completely available to the public. And what that really means is that the studies that show how air quality affects health in the real world, where you're studying real people, a large number of those studies, the majority of those studies would not be able to make all the underlying data public, because when you do an air pollution study, you collect information about people's smoking habits, about their health history. You determine oftentimes where they live and where they work, and that's private health information that can't be shared publicly. And so it's a way of creating a little bureaucratic hurdle that makes it really hard for a lot of the research out there, some of the most important research, to be used, and sort of creates a mechanism to overlook health studies that the public would want EPA to consider in setting health standards.
Thank you. We're getting a bunch of questions through the chat, so I want to jump to some of those. And a couple of questions have come in about wildfires, and certainly climate change is impacting air quality today, from fueling formation of ground level ozone to these frequent and more intense wildfires. And certainly millions of Californians have been suffering from the impacts of wildfires this year. And I think fire season is just starting. And the Clean Air Act provides powerful tools that incorporate best science, and we talked about promote innovation, but also there are some limitations. So what are the best opportunities to use the law's tools at the local, federal, or state level to drive down pollution, to address wildfires, and also how do we also incorporate this as we look at climate change? So I'll ask Wayne to start perhaps, and then ask others to jump in.
Well, I think if you looked at the fourth National Climate Assessment that was put out, I think it was a couple of years ago, maybe it was last year, where they talked about, at least in the West, you're seeing increases in ozone across the entire West. And that was primarily due to increased temperatures. And they were also talking about the increased severity of wildfires. And, there used to be a wildfire season, and now it's more likely that wildfire season is the whole year. And what we're seeing are the tremendous impacts in terms of air quality, in terms of people's health as a result of these fires. When people sort of talk about what are the things that can be done, there's a lot of talk about wildfire protection and mitigation, and the use of controlled burns to try to help reduce some of the fuel for these fires. Right now, it's very difficult to say that there is a particular aspect Paul, I think as you were alluding to, that one of the things that we utilize when it comes to air quality and planning are the use of exceptional events. And I think this is something, frankly, that's going to come under a lot of scrutiny, because an exceptional event sort of implies that this is something that doesn't happen very often. Yet now we're seeing fires happen regularly and repeatedly. And so what can we actually do to address that from an air quality perspective? How do we actually control and mitigate that? So I think there's a lot of questions that we have to address. I think that most people would say, we don't want these wildfires. How do we best control those? And I think when you have literally thousands of lightning strikes in dry areas, which was the original case for the first round of fires a month or two back, it's difficult to control that. But I think that if we can address what most people, I think, would say is one of the root causes, which is climate change, then maybe we can actually go back and these would truly become exceptional events. And so we do that by reducing carbon emissions. And I think, as you've all said, California certainly took a leadership role just 1 or 2 days ago when they announced that all future sales will be zero emission by 2035 and 2045. And I think that if we can address the climate aspects, but California is only one state, and it is something that's going to require the nation and the globe to really address uniformly. And unfortunately, what we've heard with this administration, not only have they tried to marginalize the science when it comes to public health issues, the same has been certainly true on climate issues. So we've got to, I think, make a realization that it's real, that we've got to take steps to address that. And we have to do that by trying to reduce those carbon emissions immediately.
Vickie, what about that? Should future greenhouse gas regulations consider the wildfire impacts when evaluating the benefits and the costs?
I just want to underscore that the wildfires are tragic, and we need urgent action to protect the people and the property that are in harm's way. Now, it's heartbreaking. And there's no question that as our nation moves forward to address the urgent challenge of climate change, we need to account for all of these profound harms. And as Peggy indicated, we need to address both climate and air pollution together. That is what Governor Newsom has proposed to do in calling for zero emitting vehicles, 100% sales by 2035. And in medium heavy duty vehicles, 100% in operations to the extent feasible by 2045, with urgent action to achieve zero emitting operations in our ports sooner, by 2035. As we all know, there's a heavy health burden imposed on ports. And that's exactly those are the kinds of solutions we need, which address the climate disrupting pollution, that address lethal particulates, that address smog forming nitrogen oxides, that address air toxics. And that's exactly what zero emitting vehicles will do. Interestingly, it was anticipated by Republican Senator George Murphy when in 1967, he ensured that California retained the authority it had long had to adopt protective vehicle standards. And in securing that in law, California Republican Senator George Murphy said, we need to move to a place where we eliminate the harmful air pollution from motor vehicles. So we're lagging by more than 50 years, but these are exactly kind of the root measures we need to address climate and health harm.
If I could just add, Paul, because this is really important to us, we've got attainment dates of 2023 and 2031. We've got to reduce NOx emissions by 45% and 55% respectively. The challenge is that zero emissions, the technology isn't there yet. And so we've got to look at how do we get those emission reductions as soon as possible, recognizing that zero emissions is going to get us both the greenhouse gas as well as the criteria pollutant reductions. And so what as a local air district, responsible for meeting those standards is, yes, zero emissions are great, but I can't get them in 3 years, and I got to get it out in numbers so that we can actually realize those. And so I want to make sure that we don't forego other opportunities where we can get 90% or near zero emission reductions that will help us meet and attain those standards.
Yeah, I think everyone agrees wildfires are a tremendous problem, a huge public health problem. And in some parts of the country, wildfires are actually erasing some of the benefits of the Clean Air Act. So in wildfire prone parts of the Northwestern US, if you look back to 1988, air quality's actually, PM levels have actually gone up, while in the rest of the country, they've gone down as a result largely of the Clean Air Act. And these pollution levels are orders of magnitude higher than what we're talking about. You know, what communities close to power plants experience. It's 10 times higher. So in San Francisco, in the Camp Fire, PM 2.5 levels exceeded 200 micrograms per cubic meter. You know, to put that in context, the current EPA standard is 35. So, and we see higher levels higher than that. And the studies have shown that, not surprisingly, very bad for our health. It's very clearly bad for asthma, especially huge spikes in asthma admissions. There's also evidence for cardiovascular admissions and mortality. I think the problem's going to be a complex one. Paul, you sort of hinted, should the health effects of wildfires be considered in climate regulation? So I think what you're getting at is a social cost of carbon, which is what the EPA uses to figure out what the cost is of carbon dioxide emissions. Absolutely. I think the health effects of wildfires must be part of that. And right now they're not. And so we are, that is just one way in which that social cost is being underestimated. And moving forward, we really need to get our act together, not just on carbon regulation and reducing greenhouse gas emissions, which are part of the reason why wildfire activity is going up. But wildfires are going to inevitably occur. And so from a public health standpoint, I really think that federal agencies need to work together, not only to address greenhouse gas emissions, but to figure out how we're going to protect the public from this health threat. And that's going to involve things like prescribed burning, as Wayne mentioned, and other forest management practices and public health measures to warn the public and protect them from the health effects.
Thank you. We're running short on time for this panel. I want to circle back to something that Peggy raised and ripped from another headline of the day, the impact of COVID-19, the early research that shows that people that are exposed to high levels of annual PM pollution have higher mortality, 8% increase in mortality for each microgram per cubic meter increase of PM exposure from Harvard. There's also some research out of looking at Louisiana as well, showing that not only is it higher air pollution exposure, but people of color are bearing disproportionate burden from COVID as well. And so as we look at the focus that COVID-19 has brought on systemic racism, the burden, the health burden that air pollution imposes, the health burden that a pandemic imposes, but then also as we look to address clean air and climate going forward, what lessons can be drawn, and why are there any reasons for hope or optimism, Peggy, or reasons for despair and anger? And you're on mute, Peggy.
When the current administration first started, they asked EPA staff to stop compiling data by race. So in some cases, we wouldn't have even known this information if it hadn't been for certain states. I think we've got to really look at the state implementation plans. If you're in a non-attainment area and we have the science and the health data that lets us know the impact on vulnerable populations, how are we beginning to come into attainment? How are we beginning to invest and focus on those particular most vulnerable communities. And I can't give you the answer to that, but certainly we're going to have to look at amendments to the Clean Air Act, or we're going to have to provide other kinds of legislation that really gets us to taking the science that we have on vulnerable populations and focusing on those communities to alleviate that air quality impact, whether it's through permitting, whether it's through moratoriums on any further permits, which of course still doesn't get to the legacy pollution that continues to drive the health disparities.
I think some of the biggest challenges that we see, Paul and Peggy, frankly, are at the local level in terms of land use planning. And, oftentimes I joke, give us the land use planning and we'll take care of it. But that will never happen. And I think that when you talk about this kind of institutional racism, you have to get to the land use planning aspect associated with that.
Exactly. And that's local. And again, a lot of localities are very compromised and very biased.
Yeah, without a doubt.
So we've got some other questions coming in through the chat. I think there's, building on some of the conversation that Wayne raised and Vickie talked about with the transition to electric vehicles and Governor Newsom's proposal. If the US implemented the fastest feasible programs to eliminate fossil fuel combustion by 2050, how much of the current criteria pollution problem issues would be addressed? I'll say, or earlier. 2050 is an awful long ways away to phase out. But if we were able to eliminate those sources of combustion, how would that deal with the pollution problems that you're facing in South Coast and other parts of the country?
Well, I think part of the challenge that we have is that we do have a technology advancement office that's constantly working with OEM manufacturers, with groups like Volvo and Daimler to try to accelerate the introduction of heavy-duty zero emissions. The challenge that we have is that you've got an infrastructure that you've got to have in place for these heavy-duty trucks. And as was said earlier, the biggest challenge that we have is from the goods movement sector. And that starts with our ports and with the ocean-going vessels and the drayage trucks. And then you have your freight corridor movements. And so trying to get all of that to zero emissions is the big challenge for us. And just looking at the commercial aspect associated with developing and deploying those trucks, that's where we're trying to utilize incentives. The challenge that we have with a lot of the established technology, particularly the trucks, is that those trucks are going to last anywhere from 10 to 20 years on the road. And how do you get a one owner, small business trucker to change that truck when he bought it and it's perfectly legal? And that's where the cost to actually incentivize these is tremendous. Just in South Coast alone, we had estimated that we would need close to $1 billion a year to accelerate the turnover of the heavy duty truck fleet. As you can imagine, trying to get those kind of funds is very difficult right now. And so absent an incentive program, from a regulatory perspective, we can't regulate our way fast enough. So we're continuing to try to look at all the tools that are available to us and then try to look at different mechanisms for funding. We can't necessarily give up on that. But those are some of the challenges that we face in implementing the program. They're just sort of practical, on the ground issues. And that's why we're frustrated when we hear about these aspirational and lofty goals, 2045, 2035, 2050, because it doesn't help us in 2023. It doesn't help us in 2031, where ultimately the area could face sanctions. There are a number of other aspects that we have to look at. But maybe it is the threat of sanctions. But oftentimes I will hear, they're not going to do that. So is it really going to happen? And yeah, it's like, no. And so there has to be a true enforcement of some of these aspects to get us down there. But there also has to be the resources to get us there. And when we have the technology to deploy, we should do it, and we should do everything to encourage it.
Yeah, we need to get there. And this person's question gets at really the crux of the issue. It's fossil fuel combustion. It's that simple. Fuel combustion releases the major criteria air pollutants that the Clean Air Act regulates that makes people sick. Fuel combustion releases greenhouse gases. If we can solve that problem through innovation and technology and move away from our dependence on fossil fuel, absolutely yes, the levels of those pollutants will go way down and health will be better right away. We don't have to wait for the climate to change. If you stop burning fossil fuel in an area, if the people living in that area are going to get healthier right away.
I would just add that a new study by EPA researchers indicates that the harmful contaminants that come from on-road transportation are responsible for over 20,000 deaths every year. They're also responsible for 1.5 billion tons of climate disturbing pollution every year. That's a massive amount of health and climate harm. In addition, when Governor Newsom signed his executive order, he signed it on the Ford Mustang Mach-E electric vehicle. The data shows that electric vehicles are cost savers today over the life of the vehicle. And within a few short years, will be at parity even from the initial sort of purchase costs with other vehicles. The race is on. One of the major manufacturers of vehicles in America is Tesla. They are all electric vehicle company. Ford Motor Company launched a campaign in California called California Dreamin' last week to talk about their race and their commitment to electrification. We in Pueblo, Colorado, Xcel Energy is transitioning coal units and replacing them with wind power that will provide resources for family farms in northeastern Colorado by hosting wind turbines on their family farms, and utility scale solar for the local steel mill that employs thousands of people that is more cost effective than the coal that it is replacing. We know what the problems are. The solutions are at hand. It's up to all of us to really determine what the legacy of the Clean Air Act will be over the next 50 years. And the imperative is greater justice and climate justice.
Well said.
Vickie, we're basically out of time. I want to give Peggy one chance for the final word.
Well, we all have a right to clean air, and it's clear what polluted air is doing in terms of deaths, in terms of health disparities, and we've got to find a way to begin to focus on the most vulnerable communities and bring them into stronger environmental protection.
Thank you, and thank you to all our panelists and to our audience. We will now have a brief break. You should stay logged into the Zoom. I urge you to extend this conversation using the hashtags Clean Air for All and Clean Air Act on social media. A slideshow with important information will run throughout the break, and our next panel, Innovation for Cleaner Air, will start promptly at 1:30 Eastern Time. Thank you.